Your doctor has recommended chemotherapy, biotherapy, and/or blood products as part of your treatment plan. Chemotherapy agents are drugs that kill cancer cells. Often you will hear it called chemo for short. These drugs work by stopping cancer cells from growing and multiplying. Unfortunately, healthy cells can be affected too, particularly cells that reproduce quickly, such as those that line your hair follicles and your digestive tract. This is what causes many of the side effects commonly associated with chemo. The good news is that these cells usually repair themselves after chemotherapy has ended. Side effects will vary greatly from person to person, depending on many factors, including the drugs used, the dose, and your general health. Biotherapy, also known as targeted therapy, uses drugs designed specifically for a particular disease. Chemotherapy or biotherapy may be prescribed to cure or control cancer, or to relieve symptoms and make you more comfortable. The people who will be caring for you in the Chemotherapy and Infusion Center have prepared this video to help answer your questions and prepare you for your visits. Knowing what to expect can help relieve your apprehension and help you feel in control. Please feel free to ask questions and ask the members of your healthcare team about your treatment. We are here to help with any needs or concerns. Your chemotherapy and infusion center pharmacist will provide you with drug fact sheets that will contain information about the medications you will be taking, such as names of chemotherapy or biotherapy and other medications, how those medications are given and how they work, what you need to tell your doctors and nurses before you begin treatment, possible side effects, suggestions to prevent and/or manage those side effects, a list of circumstances in which you should call your doctor immediately, and circumstances when it's okay to wait a bit before calling. Other important information you should know about medications and how often you will receive chemotherapy or biotherapy. Treatment periods are often alternated with rest periods to allow your body to get stronger before the next round or cycle of chemotherapy. Your white blood cells, WBC, play an important role in how well your immune system is working and in your ability to fight off infections. If your WBC count is too low, your chemotherapy may be delayed to give your body a chance to replenish its supply before your next dose. Sometimes your doctor will need the results of a recent blood test before a decision can be made regarding the proper medication or dose you will receive. You will need a blood test either the day before or the morning of your treatment. Allow approximately 60 minutes for the results to be available to your doctor, depending on the type of lab tests ordered. Please note, your doctor must have these results before he or she can write the orders for your chemotherapy. Not every patient needs a blood test that day, so ask your doctor to find out what days you will be scheduled for blood work. Depending upon the results of your blood work, your chemo treatment may be postponed temporarily. Once the lab results have been evaluated, your doctor will write the orders and send them to the pharmacy. A pharmacist will prepare all the medications you are to receive, and for your safety, double-check all the doses. The pharmacist cannot prepare your medications until they receive your doctor's orders and you are checked into the chemotherapy and infusion center. The staff at Roswell is always working on developing new and better ways to treat cancer, reduce symptoms, and prevent side effects. Some delays may occur within our regular busy schedule. A patient may develop an urgent or emergency condition that requires our care and attention. Another may need some extra time to understand his treatment plan. Some may require complex care. We apologize for any wait due to these unexpected events. It may seem that you are waiting a long time, or that people who have arrived after you are being taken first. Here are some reasons why this may occur. Unexpected medical emergencies arise that require the staff's immediate attention. We may be waiting for your test results, which are needed before your chemotherapy or biotherapy can be prepared and administered. A patient may have come from another center within Roswell Park, and he or she may have had all the tests required done at that center. If the chemotherapy or infusion center tells you there will be a delay, you may be given a pager so that you can go to the Resource Center for Patients and Families, which is located within the cafeteria on the first floor, the chapel, MJK Park, or the cafeteria while you wait. The staff will page you so that you will know when to return. It is best if you arrive at the chemotherapy center at your appointed time. Appointments are scheduled according to the amount of time the staff anticipates each patient will need. If you are early, you may experience an extremely long wait time. If you arrive late, you may also experience an even longer wait time, as other patients will be seen at their appointed time. Every effort will be made to minimize your wait time. If you have any questions or concerns, ask your nurse or nurse manager. Your appointment in the chemotherapy and infusion center will include the lab tests and other processes. That means that if you have an 8 a.m. appointment, the time it takes for lab test results and pharmacy preparation of the drug means that your chemotherapy will not begin for 1 to 2 hours. It is important that you are aware of this in the event you have to arrange for transportation or any other personal matter. We want your appointment to go as safely and smoothly as possible, and we want you to know what to expect so you can plan accordingly. As we strive to provide the best cancer treatments, nothing is more important to us than your safety and your comfort. Administration of chemotherapy or biotherapy can take from 30 minutes to 10 hours, depending on the treatment protocol, dose, and how it is administered. Those that require more than 10 hours are done in the inpatient section of Roswell Park or at home. Ask your doctor before your first treatment how long they expect it will take. For the remaining treatments, you can check with the nursing staff. There are recliner chairs in each individual treatment area in the chemotherapy and infusion center. Each recliner has a colored TV with cable service. Newspapers and light refreshments are available. To minimize disruption to the other people receiving chemotherapy and to prevent exposing patients with weak immune systems to infection, visitors must be over age 18. You may bring a snack with you or purchase something at the cafeteria or deli to bring to your treatment. Please avoid foods that have a strong odor, as they may cause nausea for the others receiving treatment. Dress warmly. The center may feel cool, especially after you have received IV fluids. There are blankets available for you if you desire. Please make a list of all the medications and doses you are currently taking and bring it with you to all of your appointments. If another doctor prescribes medication while you are receiving chemotherapy treatments, make sure he or she knows what chemotherapy you are receiving and when. Also, keep your doctor at Roswell Park informed of any drug, vitamin, herb, or supplement you take, regardless of whether or not it required a prescription. Some medications, vitamins, and herbal supplements may affect your chemotherapy. Please ask your physician what you may or may not take during your chemotherapy. Eat properly to maintain your strength. Clinical dietitians are available to help you to make the best decisions about your diet. If you would like to speak with a dietitian, please ask for a referral from your nurse. Avoid anyone who is sick, even if it is only a cold. The drugs used in chemotherapy need to be very powerful to kill the cancer cells. This can be very hard on your immune system and make you more susceptible to illness. You are likely to get quite sick from germs that may only give everyone else a slight cold. Get a lot of rest and include moderate exercise in your day. Talk to your friends or family about your feelings. You may find it easier to talk to someone who is less emotionally involved, such as a counselor or a support group. Ask your nurse for a recommendation. Keep your healthcare team informed. Let them know if you are not feeling well or if you are experiencing side effects. There are many options to help relieve pain, nausea, and other symptoms. In general, call your physician if you experience some common side effects, which may include have any sign of infection, fever of 100.5 degrees Fahrenheit or 38 degrees Celsius or higher, chills, cough, sore throat, pain or burning upon urination, or redness or tenderness along a vein, IV site, or at any other wound or skin irritation. Have any sign of an allergic reaction, itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness, trouble breathing, dizziness or palpitations, have unusual bruising or bleeding, bleeding that lasts more than 10 to 15 minutes or that causes dizziness, have persistent and/or severe vomiting or diarrhea, loose watery stools more than 3 times in one day, that last more than 24 hours after your treatment and/or is not relieved with medication, have problems with your eyesight, such as blurred or double vision, or if you have headaches, dizziness or extreme fatigue, tiredness, have a sore mouth or sore throat and/or white patches in your mouth or on your tongue. Talk to your doctor and nurse if you are experiencing any side effects other than those you have been told to expect, or if your side effects are severe. Preparing yourself is important. We are here to help.